I went for a training for work in San Diego. And first, I'm Sarah. Hi, everybody. Okay, so I'm a nurse practitioner and I work in regenerative medicine and stem cells. I do a little psychiatry and family medicine on the side. And so with my stem cell office, we went for a training in San Diego and I met Peter, Jackson, and Patrick, and they introduced me to X39. And it was just awesome. Right away when I patched up, I swear I felt different, believe it or not. But I definitely knew it was something I wanted to try. So I got into it and I started using it for my patients in my pain management clinic.
And okay, so let's start with yourself. What did you feel directly? So after we met you for the first time, we said, nice to meet you, Sarah, turn around. First thing we want to do is introduce myself to your C7. So we C7'd the patch on the C7, and then you noticed energy.
Yeah, I noticed a lot of energy, a lot of like just clarity. And I just had a lot of energy, like a lot of energy and a lot of mental clarity. I was more focused. I was there for a training, so that was good.
How about sleep? Did you notice anything about your sleep?
So I did. I've noticed lately that I've actually slept better. But to tell you the truth, I never really had that big of an issue with sleep, maybe just like waking up a little bit at night. But what really changed my sleep was really the melatonin patches. Those were really excellent. So X39 was like, it's great, especially like after working out and just like on a daily basis, you just feel focused, you feel a lot of energy. But for sleep, I really enjoy the melatonin patches.
Great.
The silent nights.
Silent nights. And your patients. So the people that you have now patched up, your patients in your clinic, can you explain some symptoms that has helped? The patch has helped.
So most of my clients come in with neuropathy and a lot of pain and a lot of inflammatory issues. And so in our clinic, we promote neuropathy treatment and anti-inflammatory diets. And I inject them with PRP, or stem cells, PRP is either I take their blood, spin it up, and inject it back into them, or just give them stem cells from cord blood or different places. So a lot of the clients are coming in for pain management for the most part. And neuropathy is like the most common.
And of course, this is expensive procedures. These ain't cheap.
Yeah, it's not cheap. It's not cheap. No, they're not cheap.
So with your patients, are you patching them before the procedures so they're able to get more stimulation and then after, or are you just patching them first time round just to see what the outcome is before they go in for the procedure?
So I've been a little greedy with my patches. Let me be honest. I've been a little greedy with my patches, but there's certain clients that I do patch up. And so, for instance, the other day I had a client that we just had a really great conversation before injecting him, and we just got into talking to him about a lot of things. And something just told me patch them up, just patch him and his wife up. And so I was like, I want to offer you guys something that will just kind of help with your inflammation. It's actually going to help. I've noticed that with most of my clients that I do patch up, it actually helps their injections work a lot better. And so I patched them up. I gave them a 5-day supply and didn't really think anything of it. So the next day I came to the clinic to pick up an extra day, and these clients came in again for treatment, and they were just like chasing after me. It wasn't the next day, it was the following week. This happened on the Thursday, the following week, Monday. And so they were just chasing after me when I was trying to leave. And so I was just like, oh, what's going on? What's going on? And so the wife was like, my husband, he's different. Like, these patches, I feel different. She was just like, we feel, they work. And she was just looking at me in shock. And so she was just saying like, she has more energy. She was like, talk to my husband, talk to my husband. So I went to speak to her husband. He was like, that he couldn't bend his hands. Like he couldn't bend his hands before. And so for the past 4 days, they've been patching up post-injection. And usually clients feel better within 6 weeks is really when you start to feel the injections, and at 6 months they peak. But a lot of clients may start to feel better like in a week or two. But he got patched up the day of injection and he kept patching up, and he just felt less inflammation and his skin was significantly smoother on his palms, which was kind of really odd. And so that was really interesting. And so his wife was like, please, do you have more patches on you? So I was like, no, I don't. No, I don't.
But you know where to get them.
But I know where to get them. And here's my card. That's the website there. I'll call you guys and we'll work through it. But people just like have different effects to these patches. But I've really noticed that with my clients that I inject with PRP, it really just potentiates that injection to really be more effective for them. So,
amazing. Have you got anything else that you wanted to say, Sarah?
Oh yeah, I have so many stories because I've patched so many people up, and it's like you just see like different things. I have a client that her mom was 80. I gave her injections. I patched her up, and her mom was hypertensive when I met her, and so she actually signed up and started buying patches, and she saw a significant reduction in her mom's blood pressure after starting to use X39. And so that's something she raves about. My goddaughter's grandmother patched her up with a melatonin patch. She has lupus. I patched her up with a melatonin patch. She wakes up twice a night to use the restroom. And that night, she just slept like a baby and never woke up once. And so in the morning, I'm like showering, getting ready, and they're like knocking on the door, like, Sarah, hurry, Nima has to use the restroom because she didn't wake up all night. So like she runs in and she like uses the restroom. And so like after we all get ready, and I patch her up with X39, and we were driving back to McAllen that day. And so I patched her up with X39, and she's just like, while she's driving, she's so pumped up and energized, and she has energy patches on each wrist. She has ice wave on her feet for her neuropathy, X39 on her back. And she's like, Sarah, it's just like the mental clarity. She's like, I just feel so good. And I'm like, I don't even know which patch is doing what.
They're all working. They're all doing something. It's like,
yeah, like even on her feet, she has really bad neuropathy. And when I put the ice wave patches on her feet, she's like, oh my God, Sarah, the cramping. It's like, I don't have cramping. And ice wave patches, when you put them in the right place, you really do feel the warmth.
Yeah. Well, thank you, Sarah. I really, really appreciate you being on here today. I know you're a busy woman, and I want to wish you a happy New Year as well.
Actually, last question,
Thank
Sarah.
you.
Last question. How revolutionary do you see this technology going into the stem cell world?
I think it's very revolutionary. I think it's awesome. I think this technology is just one of the people I introduced this. They said, you found the patch of life. You found the patch of life. And I'm like, it's like when you walk outside and the sun hits you, your body reacts. And we found a way to put it in like a patch, and it's effective. It's really effective.